in America, speech pathology, the field of speech pathology is 92% white and like 96% female. So we're talking to all the white women out there in our profession. What can we do as white SLPs to learn more about health disparities, to check our own biases, to examine what racism or privilege or whatever might be influencing how we treat people?
Megan, I love that question. And I think that I cannot answer what white people should do to check their own bias, but I can say this. I can say that there's beauty in community, and that some of the things that I have seen my white colleagues do that have been just so inspirational to me is that they've gotten together within their own group to have some of these open conversations and open dialogue about their beliefs, about their treatment, about allyship, about all of these things within their community. And then they've come to me or to another ally and said, hey, this question came up, we're thinking this way. Can you give any insight? And I think that that's more powerful than anything I could ever tell you, because I don't understand that white privilege. I don't understand what is a bias, what's not a bias. Like I'm just not able to speak to that part. But I do think that, and I know we talked a little bit about it in one of the articles, I do think that the more that white SLPs can get together and have open, safe dialogue to where they feel comfortable expressing their own bias, what they feel could be a bias or not a bias, and be willing to make new mistakes and be willing to be uncomfortable, I really think that that's what we need to help move our field forward, and for white SLPs to really understand their own position.
Yeah, I couldn't agree more. It's so hard to make mistakes, right? Often in our field, we're perfectionists. We want to be right. We want to be perfect. And that holds us back. We have to be willing to make mistakes, to use the wrong word, to recognize that we've made a lot of mistakes in the past and that we're constantly learning.
And I would say the other thing that I think is huge, and I did this a lot when I was doing my dissertation work, submerge yourself within different cultural experiences outside of your own. I think that not only helps you more to be more well-rounded, but it also helps you kind of understand some things that may not have been noticeable to you in the beginning. Do things that are outside of your comfort zone in order to experience different cultures. And I think that will also help you feel more comfortable with what you don't know.
Yeah, but it's been very eye-opening. Thank you so much for all of the information that you've shared with me and with my readers and listeners and the followers of Tactus Therapy. It's been a journey for us as a company, trying to recognize our own failings in the past. We've had way too many white stock images in our apps. We've been making a concerted effort to change that, to focus more on representation, over-representation, sometimes just to combat how many white faces are out there, to make people feel comfortable. Because we are mostly white clinicians who are working with a hugely diverse population. And we need to do better. We need to to do what we can so that everyone has the best outcomes.
Mm-hmm. I agree, Megan. And again, I thank you for doing the work, because I really think that we can only control what we bring to the table. And so the more SLPs like yourself are, want to do the work, I think it's just going to make our field stronger, but most importantly, it's really going to help our patients.